Psychiatric Nursing. Section 1. Introduction to Psychiatric Nursing. 1. Which of the following is a type of mental and emotional problem? A. Depression. B. Anorexia. C. Pyromania. D. All of the above. The correct answer is D. All of the above. 2. How many aspects of the patient's health must be considered in order to provide effective care? A. 1. B. 2. C. 3. D. 4. The correct answer is B. 2. 3. Which of the following is an aspect of the patient's health that must be considered in order to provide effective care for the patient? A. Physiologic. B. Psychological. C. A and B. D. Nutritional. The correct answer is C. A and B. 4. Patients with psychiatric problems can be found in blank part of the hospital. A. Intensive care unit. B. Psychiatric unit. C. Emergency unit. D. All of the above. The correct answer is D. All of the above. 5. The following are examples of community mental health programs except A. Toastmasters programs. B. Victim assistance programs. C. Family advocacy programs. D. Domestic violence shelters. The correct answer is A. Toastmasters programs. 6. Which of the following have led to the increase in incidence of mental and emotional disorders? A. Lack of support systems. B. Financial challenges. C. Child abuse. D. All of the above. The correct answer is D. All of the above. 7. According to Han Selye, the general adaptation syndrome has blank stages. A2, B3, C4, D5. The correct answer is B3. 8. During the blank stage, any type of physical or mental trauma triggers immediate biological responses designed to counter stress. A. Resistance. B. Alarm reaction. C. Exhaustion. D. Introduction. The correct answer is B. Alarm reaction. 9. The blank stage occurs when the body starts to adapt to prolonged stress. A. Adaptation. B. Alarm reaction. C. Resistance. D. Exhaustion. The correct answer is C. Resistance. 10. Mental disorders occur within which of the following age groups? A. Below 20. B. Above 20. C. Above 60. D. Any age group. The correct answer is D. Any age group. 11. The rate of teenage depression has blank within the past 20 years. A. Decreased by 20%. B. Increased by 20%. C. More than tripled. D. Remained constant. The correct answer is C. More than tripled. 12. Among the elderly, the following have contributed to an increase in depression except A. Isolation. B. Loneliness. C. Sickness. D. Fear. The correct answer is C. Sickness. 13. A syndrome or pattern must be considered as a blank before it can be taken as a mental disorder except A. Behavioral dysfunction. B. Psychological dysfunction. C. Biological dysfunction. D. Nutritional dysfunction. The correct answer is D. Nutritional dysfunction. 14. The DSM-4TR, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, uses a blank approach. A. Classical. B. Traditional, C. Multiaxial, D. Clinical. The correct answer is C. Multiaxial. 15. According to the approach stated by the DSM-4-TR, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, every patient must be evaluated on blank axes: A2, B3, C4, D5. The correct answer is D5. 16. The following are axes on which patients can be evaluated except A. Physical evaluation, B. Clinical disorders, C. Personality disorders and mental retardation, D. General medical conditions. The correct answer is A. Physical evaluation. 17. Personality disorders and mental retardation is evaluated in which axis? A. Axis 1, B. Axis 2, C. Axis 3, D. Axis 4. The correct answer is B. Axis 2. 18. Which of the following is an example of a patient's diagnosis on axis 3? A. Recent remarriage, B. Death of father, C. Acute bleeding episodes, D. Adjustment disorders. The correct answer is C. Acute bleeding episodes. 19. Blank is known as the level of functioning reported as a number from 0 to 100 based on the patient's overall psychological, social, and occupational function. A. Psychological and social functioning assessment. B. Global assessment of functioning. C. Psychosocial and occupational assessment functioning. D. None of the above. The correct answer is B. Global assessment of functioning. 20. Life events or problems that may affect diagnosis, treatment, and prognosis of the mental disorder is evaluated under which axis? A. Clinical disorders, B. Personality disorders and mental retardation, C. Psychosocial and environmental problems, D. General medical conditions. The correct answer is C. Psychosocial and environmental problems. 21. Which of the following is an example of a patient's diagnosis on axis 2? A. Obsessive-compulsive personality, B. Crohn's disease, C. Acute bleeding, D. Death of parent. The correct answer is A. Obsessive-compulsive personality. 22. All of the following are roles performed by nurses in helping troubled patients except A. Prescribe drugs, B. Administering prescribed drugs, C. Monitor drugs' effect, D. Act as primary therapist. The correct answer is A. Prescribe drugs. 23. Which of the following places can a psychiatric nurse practice? A. Psychiatric hospitals, B. Schools, C. Prison, D. All of the above. The correct answer is D. All of the above. 24. To care for patients, you need to develop a blank and orderly way of dealing with problems. A. Practical, B. Theoretical, C. Classical, D. Manual. The correct answer is A. Practical. 25. A psychiatric nurse can take up which of the following roles? A. Program evaluator, B. Researcher, C. Consultant, D. All of the above. The correct answer is D. All of the above. 26. Blank defines nursing practice and performance. A. Association practice standards, B. Professional practice standards, C. American professional practice, D. Professional association practice. The correct answer is B. Professional practice standards. 27. Collecting patients' health data is related to which of the following standards by ANA, American Nurses Association? A. Standard 1, B. Standard 2, C. Standard 3, D. Standard 4. The correct answer is A. Standard 1. 28. The nurse implements the interventions identified in the care plan relates to which standard according to the ANA, American Nurses Association? A. Standard 5A, B. Standard 5B, C. Standard 5, D. None of the above. The correct answer is C. Standard 5. 29. The Standard 2 of the American Nurses Association Standards of Care stipulates which of the following? A. The nurse collects patients' health data. B. The nurse analyzes assessment data. C. The nurse develops care plan. D. The nurse identifies issues wrong with patient. The correct answer is B. The nurse analyzes assessment data. 30. Nurses are expected to select interventions according to their blank. A. Practice level. B. Age level. C. Salary level. D. All of the above. The correct answer is A. Practice level. 31. According to standard blank, the nurse provides structures and maintains a therapeutic environment in collaboration with the patient and other health care providers. A. Standard 5A, B. Standard 5B, C. Standard 5C, D. Standard 5E. The correct answer is B. Standard 5B. 32. The basic level nurse may select which of the following interventions? A. Milieu therapy. B. Crisis intervention. C. Community-based care. D. All of the above. The correct answer is D. All of the above. 33. Which of the following must be performed only by the APRN-PMH, Advanced Practiced Registered Nurse in Psychiatric and Mental Health? A. Consultation. B. Counseling. C. Implementation. D. None of the above. The correct answer is A. Consultation. 34. Blank model holds that behavior is motivated by avoidance of anxiety and attainment of satisfaction. A. Psychoanalytic model. B. Interpersonal model. C. Social model. D. Medical model. The correct answer is B. Interpersonal model. 35. Blank model holds that disease is the cause of deviant behavior. A. Nursing model. B. Medical model. C. Psychoanalytic model. D. Communication model. The correct answer is B. Medical model. 36. The blank model emphasizes the person as a biopsychosocial being. A. Existential model. B. Nursing model. C. Medical model. D. Social model. The correct answer is B. Nursing model. 37. The blank model proposes that the entire sociocultural environment influences mental health. A. Environmental model. B. Social model. C. Socio-environmental model. D. Communication model. The correct answer is B. Social model. 38. According to the humanistic model, understanding human behavior requires familiarity with blank levels of need. A. 4, B. 5, C. 6, D. 7. The correct answer is C. 6. 39. Physiological survival is on level blank on the humanistic model Maslow hierarchy. A. Level 2, B. Level 3, C. Level 1, D. Level 4. The correct answer is C, Level 1. 40. Which model focuses on patients' actions? A. Communication model. B. Behavioral model. C. Social model. D. Nursing model. The correct answer is B. Behavioral model. 41. Based on blank model, nursing developed the concept that the nurse should work to restore the patient to a state of full life from a state of self-alienation. A. Existential model. B. Medical model. C. Behavioral model. D. None of the above. The correct answer is A. Existential model. 42. There are blank number of phases in the nurse-to-patient relationship. A6, B5, C4, D3. The correct answer is C4. 43. At the blank phase, the nurse assesses the patient for unresolved problems. A. Introduction phase. B. Preliminary phase. C. Pre-interaction phase. D. Scheduling phase. The correct answer is C. Pre-interaction phase. 44. During the blank phase, nurse reviews and summarizes patient's progress. A. Concluding phase. B. Termination phase. C. Ending phase. D. Working case. The correct answer is B. Termination phase. 45. Which of the following factors can influence verbal communication? A. Patient's past experience. B. Patient's cultural background. C. Patient's religious background. D. All of the above. The correct answer is D. All of the above. 46. Which of the following factors can prevent effective communication between the nurse and the patient? A. Environment. B. Native language. C. Sexual orientation. D. All of the above. The correct answer is D. All of the above. 47. Nonverbal communication can include which of the following? A. Silence. B. Writing. C. Speaking slowly. D. None of the above. The correct answer is A. Silence. 48. Therapeutic communication includes the following except A. Minimizing. B. Validating. C. Restating. D. Focusing. The correct answer is D. Focusing. 49. Non-therapeutic communication blank. A. Encourages insight. B. Creates stumbling blocks. C. Supports problem solving. D. Reduces stress. The correct answer is B. Creates stumbling blocks. 50. Blank is the process of identifying a patient's psychosocial problems, strengths, and concerns. A. Psychiatric identification. B. Psychiatric assessment. C. Psychiatric intervention. D. None of the above. The correct answer is B. Psychiatric assessment.